Does everyone need surgery?
Yes and no. So there's a lot of people that make it through life without an ACL. There are very few people that make it through sports without an ACL. Everybody comes back to the Hines Ward. Being here in Pittsburgh, everybody knows that Hines Ward plays without his ACL. He would be termed what's called a coper, and there was a group from, I think they're from Delaware, a sports medicine group out of Delaware, that came up with this copers, non-copers thing. Copers are able to continue to have great biomechanics even without their ACL torn, but it's still not recommended that people continue to go and play sports without it, because you're going to create so much wear and tear on the knee. And actually the reality of it is, long term, the studies show that whether you get it repaired or not, you're still going to end up with some arthritis. But what ends up happening is that if you decide to not get it repaired and try to do higher level activities, number one, you don't get back to the same level of function that you were. So if you're looking at trying to get back to being competitive in the sport that you were in, you need to get it fixed. If you're done, it's your senior year of something, or it's your last year and you're retiring and you decide that you don't want to go through the surgery and the rehab, that's fine. It's not going to be a big deal. But getting back to that level where you were at, typically, like I said, 9 times out of 10, you're going to need to have it fixed. If you decide not to get it fixed, however, most people, and the research shows this, they do not go back to the same level of function. They may get back to some level of recreational exercise, wherever they were before they were before they got the ACL tear, before they had the surgery. They usually do not make it back to that level, and that's really with whatever age group that you're talking about. And really, a lot of older people don't have it fixed when they tear it. If you're 45 or 55 and you don't really do a whole lot of people won't have it fixed. Unfortunately, now you're identified as somebody that has a bad knee. Okay, you're not going to get back to being 100%, and also your physical function is going to decline, and that's something that we don't really want to have as a trade-off. And I think that we're seeing physical therapy becoming more prevalent in society today because of that. You don't want to give somebody the opportunity to physically decline over time, because they end up with all kinds of problems. Our bodies were meant to move, and they were meant to move a lot. Whether you're 20 years old or you're 80 years old, life doesn't accept sitting in a chair all day. Fortunately for us, we have the technology that allows that to happen for people that can't move and can't take care of themselves. But it's not something that you want to accept, that you're going to have this ever declining kind of downward spiral going on. And even with the high school kids, that happens. They tear their ACL, and really the world kind of seems like it's going to be over for them. Fortunately today we have these great rehab techniques and great surgical techniques that allows them to get back if they get to the right place.